I'm Dr. Obaid REEDY from Afghanistan. We will be talking about diabetes and the macrovascular complication of diabetes. Let's know what diabetes is. Diabetes is a metabolic complication which is characterized by chronic hyperglycemia, disturbance in metabolism of carbohydrate, protein, and fat. In diabetes, there is either deficit in insulin secretion, insulin action, or both of them. Uncontrolled diabetes develop towards different complications and damages different organs of the body. We can divide chronic complication of diabetes into two main categories. One is called microvascular complication and another is macrovascular complication. Microvascular complication includes retinopathy or damage to eye and eye tissues. Second is nephropathy or damage to kidney, and third is neuropathies. We can divide macrovascular complication into 3 or 4 types. Number 1 is cardiovascular disease like myocardial infarction. 2 is cerebrovascular disease like stroke, and 3 is peripheral vascular disease including diabetic foot. Erectile dysfunction also comes under the macrovascular complication of diabetes. Cardiovascular complication is one of the major complications of diabetes. We should know that 75% of diabetes patients die because of cardiovascular diseases. And also, the cardiovascular events are 2 to 4 folds more in diabetes patients in comparison to normal individuals. Now we should know what are the risk factors for developing cardiovascular complication. First is smoking. Second, chronic hyperglycemia. Third, hypertension. Fourth, dyslipidemia or abnormal levels of lipids in the blood. And also the fifth one is obesity. For diabetes patients, it's very important to know the preventive measures which are very important for the delaying or preventing from the cardiovascular complication. We can divide these preventive measures into main categories. One is called primary and another is called secondary prevention. Primary prevention is for those diabetic patients who are at risk of developing cardiovascular complication. And secondary measures are for those patients who have established cardiovascular disease. The primary preventive measures include smoking cessation or stopping smoking, which is very important. Second is keeping the glycemia within the recommended ranges through lifestyle changes like diet, exercise, and also their medications are available. Blood pressure, it's very strongly recommended for the diabetes patient to keep their blood pressure within the recommended ranges. According to NICE recommendations, the blood pressure for diabetes patients who have not developed complication is less than 140 per 80, and for those who have developed complications like retinopathy or nephropathy, the recommended range for them is less than 130 per 80. Another preventive measure is to keep the lipids within the normal range through diet, exercise, and also medication. It's also important for the diabetic patient to have exercise. The low level of exercise is 30 minutes per day, most days of the week, or at least 5 days per week. And also for the diabetes, one of another preventive measures is antiplatelet therapy. Diabetologists and also cardiologists they advise aspirin as antiplatelet therapy. The action of aspirin is prevention of coagulation or clotting of blood in the blood vessels. Another macrovascular complication of diabetes is diabetic foot. Diabetic foot manifests as an ulcers, deformity, and also in advanced cases it can cause osteomyelitis and also gangrene, which can be limb-threatening and also life-threatening conditions. Hyperglycemia, hypertension, and dyslipidemia, all these three factors, they cause nerve damage and also blood vessel damage. When nerves and also vessels are damaged in the lower extremity, they cause feelingless and also ischemia. And these both cases, they are the underlying cause of developing diabetic foot. And then, if we keep three principles in mind, number one, to keep the glycemia within the recommended ranges, prevent from hypertension and maintain the blood pressure within the recommended ranges, and avoid from dyslipidemia and keep your lipids within the normal ranges. If we keep this and apply these three principles in our life, we can prevent and also delay from the developing of the microvascular as well as the macrovascular complication of diabetes. Thank you.